So we're going to start your physical assessment. I'm going to look at your hands. I'm looking at your fingers, looking at your nails, feeling the temperature, the moisture. We're going to do your capillary refill. It's less than 3, which is good. Hands are cold. Mine are hot. All right, go ahead. Looked at your fingernails. Everything looks good. Take your glasses off for me. Here. Put them over here. We don't, in case when I have to make you lay down, I don't break them. We look at your scalp, look at your head, feel your head. Usually we look at hair distribution. There's no head, no hair, no head. I always gotta mess something up. Any pain when I'm palpating your head?
No.
Alright. Alright. I'm feeling back here at the bony processes on your skull. Any pain there?
No.
Alright. Alright. I'm gonna feel here. I'm gonna have you smile. Puff out your cheeks. Wrinkle your forehead. Wrinkle your eyes, sorry. Sorry. I'm looking at your skin while I was doing that. Sorry, looking at you. Oh, sorry. That was cranial nerve number 7. That's your facial nerves. I'm going to have you open and close. Close. Open again, close. And I'm feeling your masseter and your temporalis muscle. Also your trigeminal nerve. Okay, good. Any pain here on your maxillary sinuses?
No.
Your frontal sinuses?
Nope.
Good. No pain at all?
Nope. No pain at all.
All right. Looking at your eyes, looking at the hair, your eyelashes. All right, I'm going to have you look up, look down, looking at the color of your sclera, your iris, your conjunctiva. We'll grab the otoscope. So we did cranial nerve number 2 prior to coming in here because I don't have a card. So that's your vision, visual acuity, 20/20 with corrective vision. And we're going to check cranial nerves number 3, 4, and 6, which is a cardinal rule of 6, or the cardinal rule of 6. And I'm going to have you follow my finger. So look at my nose, and what we're going to do is I'm going to have you go out and back in, up and back in, and then down and back in, out, back in, up and back in, and then down and back in. And then what I'm going to have you do is look over my shoulder here, and then I'm going to check your reaction to light, and I'm going to do it twice after I blind myself first. We're having a doozy of a day. So I'm going to do it twice. So I'm checking for equal reaction with your pupils to accommodation to the light. So I'm going to have you. Good, 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 good. And now I got to get a little up close and personal. So I'm going to check with on your left side with my left side. I'm looking for the red light reflex. I'm looking there for the optic disc, the macula, the vessels. Ready? I'm going to do this side now, so we're doing the same thing again. Good. So we're going to look at your ears. I'm going to feel the outside part of your ears. I'm looking for, first I should look, sorry. I'm going to look at your ears, looking for symmetry, looking for any abnormalities, looking for any abnormal skin. I'm going to pull on your auricle, pushing on your tragus. Any pain here?
Nope.
Okay, good. Good. Oh, I already have a In your eyes, I forgot to say that I was looking at your red light reflex, the optic disc, uh, the optic vessels, the macula, and the optic fundus. And I actually seen both in both eyes, so I apologize. So I'm going to look in your ears, and I'm actually looking, I'm going to pull your ears up and back, and I'm looking here in your left ear first. And what I'm looking at is the auditory canal. I'm looking at your tympanic membrane. And what I'm looking for is the cone of light, which is at the 7 o'clock position. Looking at the malleus, which is intact, tympanic membrane is intact. Pearly gray color, so no cerumen noted. And then we're going to look at the left side, or the right side, sorry. I guess I should learn my left from my right. I'm going to have you look this way just a little bit. And again, pulling up and out. Right side, the cone of light is noted at the 5 o'clock position. Tympanic membrane is intact. Pearly white, gray color. Looks to be a little fluid. Canal is clear. No cerumen noted. And then so this time we're going to go in your mouth, so I apologize. Oh, wait, I forgot to do one thing. Take my gloves back off. Your auditory canals are both clear. So I'm going to test your hearing. And what I'm going to do is I'm going to let me know when you can hear.
Okay.
Yes or no? Can you
Yes.
hear? Sorry. I guess I wasn't specific. Okay. Well, okay can mean many things. I apologize. Now I'm going to look in your mouth, and I'm going to feel your soft palate and your hard palate. I'm also going to be looking at your teeth and your gums and looking at your oral mucosa. Should look at your nose first. Sorry, I'm going to do your nose first. Now you look up. I'm going to look at your nasal passages. I'm looking at your nares. Nasal turbinates in your septum. You do have a deviated septum on that left side. Sorry, we're going from clean to dirty, or dirty to dirtier. Where's my alcohol wipe? Oh, I'm going to have test cranial nerve number 1, which is your, hold on. Let me see, do I have anything, olfactory nerve, let me see if I have anything that you can smell. We'll improvise. I know you don't like sniff. What was that?
Lemon lime spray or 7-Up.
I apologize. I know you don't like that.
It's fine.
So we looked at your nose, looked at your terminates, clear nasal mucosa, a little redness in the left side where you have that. Whoop, blind me. I need help here. So now I'm going to look in your mouth, and we're going to look at your oral mucosa. I'm going to have you open your mouth. Take your tongue to the left, to the right, up. All right. Your tongue out. All right. I'm going to feel in your mouth. A little dry in your mouth. You can see. I'm not going to gag you. That's cranial nerve number 10. We don't have to gag you. That's a good thing. That's a... Yeah, I don't want to gag you. Saying is cranial nerve number 9. Say Stick your tongue out again. That's cranial nerve number 12. Gag reflexes. Cranial nerve 10 is your gag reflex. I apologize. Trying to remember my cranial nerves before I move on. Looking at your neck, sorry. I'm gonna have you sit up a little bit. Looking at your neck for any symmetry, any pulsations. Alright, now we're gonna go into your lymph nodes. So if you're looking at your, feeling for your occipital lymph node, posterior auricular, your preauricular, posterior cervical, superficial cervical, and I'm gonna have you turn your head this way, the deep cervical chain, your digastric, submandibular, submental here. I'm gonna have you relax a little bit. Supraclavicular, and trachea. Just feeling to see if it is midline. Alright, I'm going to test your spinal accessory nerves, and that's cranial nerve number 11. I'm going to have you go side to side, forwards, backwards. I'm going to have you push to the left, push to the resistance, and push to the right. Alright, good. Now I'm going to listen to your carotid. So I'm going to have you take a deep breath. I'm going to take a deep breath and hold it. Go ahead. What I'm looking for is a carotid bruit. Go ahead and take another deep breath and hold it. Good. Good. Now I'm going to palpate your thyroid and let me know, do you need a drink of water or anything for us to do it?
No.
Okay. I'm going to have you take a nice deep swallow for me. Alright, good. So what I'm going to have you do is turn around for me. So we're going to look at your back. So let's turn the computer a little bit. So now we're looking at the posterior aspect of the back, and I'm looking at your skin. I'm looking at your, I'm feeling and seeing if there's any pain or anything.
No.
Okay. No pain good, noted. Alright, so I'm going to palpate here. Looking for resonance in your back. And then I'm going to, looking for symmetric chest expansion, and I'm going to put my hands here, near that 10th rib here. And I'm going to have you take a deep breath. Good. And what I'm looking for is equal chest expansion on both sides. Good. Alright, and so now I'm going to put my hands on your back and I'm going to do tactile fremitus. And what I want you to do is I'm looking for even vibration. So when I put my hands on your back, I'm going to have you say 99 and say it like this so where I can hear it. So go ahead.
99.
Good.
99.
Good.
99.
And again.
99.
Good.
99. 99.
Good. Good. Now I'm going to check the spinous process for you. I'm going to open for a little bit. Now, do you have any pain here?
No.
Okay, so no pain noted when I'm going up that spine. Okay, good, good. All right. Let me check for some CVA tenderness. So this is going to kind of, might be uncomfortable. Let me know if you have any pain. Any pain?
No.
No pain?
Nope.
Any pain?
Nope.
Okay, good. All right. Now what I'm going to do is I'm going to listen for some lung sounds. And when I put my stethoscope on you, I want you to take some full deep breaths. And each time I'm just going to have you take a full deep breath in and a full deep breath out.
Okay.
Sorry, my pants are falling down. All right, take a deep breath for me. And again. And again. Good. And now I'm going to do what we call eugophony. And so when I put my stethoscope on you, I'm going to have you say E each time I put my stethoscope on you. So what I'm trying to hear is the equal sound when I put this bell on you.
E, 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 E.
All right, so now we're going to go to the anterior aspect of your lung, or to your chest. Sorry, I'm going to have you turn back around. So now we're looking at your chest again. I apologize. So now we're looking at the shape of your chest, any abnormalities, any pulsations that you might be having, any air pockets that you could have, any pain there when I palpate on here?
No.
Okay. So now we're going to palpate the infraclavicular lymph nodes. So I'm going to have you take a deep breath for me. Okay, and let it out. And I'm not feeling those infraclavicular lymph nodes, which is a good thing. Sorry. Spewing my cooties. I apologize. Let me get a drink. Good thing I brought my drink. I apologize. So your lymph nodes there, we don't want to feel them. So now I'm going to listen to your lung sounds here. So when I put the stethoscope on you, so I'm going to have you take a deep breath in and let it out. I don't have to repeat it, so you can just go ahead and so go ahead. So now we're going to do some range of motion here. So I'm going to do some hand range of motions with you. So I'm going to have you hand range of motion in and out. All right, so now I'm going to have you do some strength and resistance. So don't let me push them. Don't let me pull them. All right, now I'm going to have you take your shoulders and cross them. Take your arms out. Take them up. You take them back. Good. There, I'm going to feel some axillary lymph nodes here. Not feeling any axillary lymph nodes. So now I'm going to feel your brachial pulses, and they are 2 plus, bilateral equal, radial 2 plus, bilateral, and they're equal. Now I know I'm missing need to think of. So I'm going to do we'll do, when I remember what else I need to do. So I'm going to look for your PMI, which is your point of maximal impulse. And so I'm going to have you lean forward just a little bit, which is at your 5th intercostal midclavicular. Good. And I'm listening for good. 84. So now I'm going to listen to your heart sounds, and we're going to start with the diaphragm, and we're going to listen to it with the bell. So we're starting with the aorta. Hold on. So we're starting with the heart. Oh, sorry. So we'll do this with the diaphragm and the bell. So we're listening to your aorta, which is at the second intercostal right sternal border. And then we're going to go to the pulmonic, second intercostal right sternal border. Erb's point, third intercostal left sternal border, and your pulmonic tricuspid, fourth intercostal left sternal border, and then your mitral valve, fifth intercostal left sternal border. Now I'm going to repeat. Aorta, second intercostal right sternal border, pulmonic, which is at the second intercostal left sternal border, Erb's point, the third intercostal left sternal border, tricuspid, fourth intercostal, left sternal border, and your mitral valve, fifth intercostal left sternal border, and now comes the fun. You get to lay down, and we're going to assess your belly, your stomach. So we need to make sure we can see you on the bed. So I'm going to have you lay down for me. Let's make sure we can see all of it. All right, so we might need to move the bed a little bit, so I apologize. Let's hook this to the bed. So what we're doing is we're looking at the abdomen. We're making sure that we can see everything is, yeah, you can just put your arms to your side, sorry. So what we're looking for is symmetry. So we're going to look for anything, and then we're going to assess your bowel sounds, which we do in all 4 quadrants. For today, we won't listen to it for a full 5 minutes in each. Then I'm going to listen to your abdominal aorta. And then we're going to listen for your renal arteries. And your iliac arteries. Hopefully. And we're going to percuss for your liver span, which is here on this side. So I have my handy dandy tape measure. That's about where your liver is, starts. Your liver is about 6.5 centimeters, which is normal. So now we're going to do some soft, some light palpation, and let me know if any of this is painful. Your stomach is growling.
No breakfast.
I'm sorry. Let me torture you with that. And now we're going to do some deep palpation. Relax just a little bit. Makes it a little bit harder. And now what I'm going to do is I'm going to palpate for your liver. All right, so what I'm going to do is I'm going to have you take a nice deep breath, and I'm going to have you let it out. Go ahead. The liver border is palpable. And then over here, what I'm going to do is I'm going to palpate for your spleen. So I'm going to have you do the same thing, is take a nice deep breath and then let it out. Let it out. Spleen is not palpable. Good. All right, let me think. I got to remember what else I got to do here. So after we do your stomach, we did that. I got to regroup. I got to think about what's next. Sorry. All right, so I'm going to have you sit up. We're going to move to lower extremities. I'm going to check I think I'm going to move this down a little bit so we can see your lower extremities. So I'm going to check pulses here at the popliteal. I'll move it down a little bit further. We might have to move the bed up. So popliteal, they're bilateral equal, 2 plus. And then, we're going to move the bed up. I think this takes it up. We'll get your feet in there eventually. Huh? What?
Air conditioning.
So we'll listen. So I'm going to do your posterior tibial, your dorsal, posterior tibial, your dorsal pedis. They're 2 plus, bilateral, equal bilateral. Good. What I'm going to have you do is lift your feet, do some range of motion with your feet down. All right, don't let me push. Don't let me pull. Good. I'm going to have you close your eyes for a minute, and I'm going to, open your eyes for a second and let me know in a minute if we're doing an up or down motion on your toes. Okay? So
Okay.
what is, am I doing up or down?
Up. Up. Down. Up.
Good. And I'm going to have you, all right, I'm going to stand up. So now what I'm going to do with you, I'm going to have you walk across the room. Hold on a second. Let's figure out how we can make this. So I'm going to have you walk this way. Okay, good. Then I'm going to have you come right back here and walk heel to toe. Gotta make sure we get this. Heel to toe. Here. Let me figure out how to make this work better. All right. Hold on. The camera's got to catch up with us. So I'm going to have you walk. Well, if I was a better camera taker, heel to toe. Okay, good. Now stop. I'm going to have you stand with I'm going to have you take your right leg or left leg, whichever, and move straight forward, back, and then the opposite. Good. And then back. Take 1 foot and take it down the opposite shin, and then opposite. Good. And then I'm going to have you stand and hold the bed and do a knee. There you go. And now what I'm going to have you do is close your eyes and put your feet together first. And put your arms straight out to your side. Straight out to your side. All right, good. Now it's looking for the Romberg sign, and that's a negative Romberg sign. And I'm going to have you open your eyes back up and bend straight forward. And I'm looking for scoliosis. I'm going to have you bend straight back. Good. And go side to side. Good. All right. And now I'm going to have you go ahead and have a seat again for a minute. I'm going to do a couple things. I'm going to do some stereogenesis, which I'm going to put an object in your hands, and you're going to tell me what it is, but you're going to have your eyes closed. Here. Go ahead.
The coin, quarter.
Okay.
Paper clip. Cotton ball.
Okay, now I'm going to have you take your finger to your nose and go opposite. Eyes closed. Go. Faster, 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 faster. Good, good, good. All right, so now we're going to do something different. We're going to go do an object that's soft or dull. So this is my soft, and you're going to close your eyes and we're going to identify whether it's soft or dull. Okay? All right, so, sorry.
Dull. Soft. Ball. Soft. Dull. 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 Soft. Dull.
All right, now we're going to do some reflexes. So we're going to do, now you have jellyfish arms. So we're going to check your tricep. Good. Now we're going to do your bicep. Good. Do your brachioradialis. Good. I'm just going to go down this side. Do your patella. You ready? Good. And then I'm going to have you. Can you hold that just a little bit so we can do this one? I'm going to do your Achilles. I'm going to have you hold your foot here. Good.
Mm-mm.
No?
Yeah, there's not.
You can't see it?
There's not recording.
Yes, it is.
Oh.
Your Achilles. We're going to do we're going to go to the next side. And then I'm going to do a Babinski on you. So let me get over here. So we still need to do the Babinski. So we are going to do, you're good. We're already over in the video, so they may stop it. Your tricep. Then I'm going to do your bicep. And then I'm going to do your brachioradialis. That one not get up. Good. I'm going to do your patellar. Oh, that one I got a good response from. All right, now I go to the camera again. All right, and we're going to do your Achilles. And then we're going to check for a Babinski. So I'm going to have you, there we go. Negative Babinski, which is good because you're only supposed to see those in babies. And I believe that might be the end of our we did a shallow knee bend. We walked across the room. I think that's the end of our video. Hopefully we hit it all. Thank you.